Well, good afternoon, students. Today I am going to show you the dissection of the testes and the spermatic cord. This part is the testes, and this part here coming out from the upper pole of the testes is called as the spermatic cord, which will go right up to the deep inguinal ring through the whole of the inguinal canal. Now the spermatic cord, as it comes out from the superficial inguinal ring, it is covered by the three fascia. External spermatic fascia, which begins at the margin of the superficial inguinal ring, and it will cover the complete testes. Then the second layer of facial layer is the internal spermatic fascia, which begins at the lower margin of the internal oblique muscle, which also contain the muscular fibers of the lowest fibers of the internal oblique, that is the cremasteric muscle and fascia. Then the third layer is the internal spermatic fascia, which is nothing but the prolongation covering to the spermatic cord and testes is the internal spermatic fascia, that is fascia transversalis, the prolongation of fascia. So there are three fascia which covers the spermatic cord right from the superficial inguinal ring. They cover the whole of the spermatic cord, and then they cover the testes also. Now, if you see the coverings in the scrotum, right from the scrotum up to the testes, they will be the skin and superficial fascia. And superficial fascia is divide of the fat, and is place there are only the loose connective tissues are present in superficial fascia, and it also contains the muscle called as dartos muscle. So the skin and superficial fascia containing dartos muscle are the layers of the scrotum, and deep to these two layers there are these layers, which I have just described, which are covering to the testes and spermatic cord. That means external spermatic fascia, cremasteric muscle and fascia, and the internal spermatic fascia, covering to both testes and the epididymis. Now, I will try to just dissect the external spermatic fascia first, which is covering to the spermatic cord and to the testes. This is a fine fascia, very fine fascia. And let me lift the fine fascia from the surface of the testes and spermatic cord, and I will give a cut in this fascia to remove it from the spermatic cord and testes, so as to expose the second fascia, that is the cremasteric muscle and its fascia. Trying to find. This is the external spermatic fascia, which I will first remove in the whole length of the testes and spermatic cord. So I am trying to cut the external spermatic fascia. See this fascia. This is the external spermatic fascia. Now this fascia, they are just fused with each other, so I am finding it difficult to remove. And after removal of the external spermatic fascia, then I will show you the second fascia, that is the cremasteric muscle and its fascia. So this I am removing the external spermatic fascia now from the spermatic cord. See this fascia. This is the external sperm. What difficulty I am facing here is that it is real difficult to remove this because there are adhesions okay, between the external spermatic fascia and the cremasteric muscle and fascia onto the testis as well as onto the spermatic cord, but just I have to remove it so as to expose you the second layer, that is the cremasteric muscle and its fascia. From the most of the part, the cremasteric muscle and fascia, which is the second layer, will show you the muscular bands or the slips, muscular strains, which are coming from the internal oblique muscle. Now I am cutting the cremasteric muscle and its fascia. And then I will show you this cremasteric muscle and fascia, which is covering here to the spermatic cord, and then it will cover to the testes also. Again, as I said, there are adhesions between the cremasteric muscle and its fascia and deeper fascia, that is the internal spermatic. Now you can see some of the part I could remove, that is the internal cremasteric muscle and its fascia. As from spermatic cord, it is continuing on to the testis. You can see here some of the muscle strands. See this? Can you see this muscle? Let it focus. See this? These are the muscle bands. Okay? Cremasteric muscle is going here. See this? It is going here. See this cremasteric muscle. Very strong muscle fibers and band, and in between is the fascia. So this is called as cremasteric. It is going on to the testes. After covering to the spermatic cord, it is going on to the testes. I am cutting this fascia from the testes. Some of the fibers, this adhesion is there, so I am not able to separate it from the internal spermatic fascia, which is very intimately should cover to the testes. Okay, this is the, if muscle fibers are seen, yes, muscle fibers are seen in it. So this is the cremasteric muscle, okay, this is the cremasteric muscle band, okay, here, and deep to it should be the internal spermatic fascia, a very thin layer which is the continuation of the fascia transversalis or prolongation of the fascia transversalis. I am just removing the cremasteric muscle and its fascia from spermatic cord and trying to just trace its continuity onto the testes. So I am just successful in removing the most of the part of this cremasteric muscle and its fascia. Now I think you can see clearly. Yes, can you see this cremasteric muscle and muscle bands are here? See this? This is the cremasteric muscles and the fascia. In between the muscle strands, there are the presence of the fascia. This is the cremasteric, which covers the whole of the spermatic cord and then the testes. And then deep to it, I think it will be real difficult to remove and to show you the internal spermatic fascia, but I will try. I will try to show you the internal spermatic fascia. Right, with the tip of my knife, I will try to lift the fascia, that is the deepest fascia, and that is the internal, yes, I could lift some of it. See, these adhesions are making it real difficult to remove. See this on my tip. This is the internal Can you see this now? This is the internal spermatic fascia. Okay. So these are the three fascia which covers the testis and the spermatic cord. Now, after removal of these three fascia, let me remove the whole of this internal spermatic fascia so that, yes, I will just remove this internal so that we will go to the contents of the spermatic cord. We will go just to the contents of the spermatic cord. Oh. Now, deep to this internal spermatic fascia, which I have just removed, there is another closed sac, serous sac, and this closed serous sac, after removal of these three fascia, is called as the tunica vaginalis. And if I put this knife or the scalpel, okay, by giving a cut here into the tunica vaginalis, then this is the cavity. Okay, let me put this. This is the cavity, okay, of the tunica vaginalis, and from this cut, if I reflect it, tunica vaginalis, then it should expose the testes and the epididymis, okay. And what is tunica vaginalis? It has a parietal layer, and then it has a visceral layer, and through this parietal layer I have given a vertical cut. Again, there are a lot of adhesion between the testes and this tunica vaginalis parietal layer. See this. Now, this is the space between the parietal and the visceral layer of the tunica vaginalis. You can see here this. So I have given a vertical cut in the tunica vaginalis, and now what you are seeing here is the epididymis, and in front of it is the testis. So this is the parietal layer of the tunica vaginalis, and the visceral layer of tunica vaginalis is covering to a part of this epididymis and to the testes. Okay, so I am will give a cut and remove this parietal layer so as to expose the whole of the testes. Lot of adhesions are here between two layers of the. I am just breaking those adhesions so as to completely expose the testes. See this. See, here is the testes and epididymis exposed. Okay, so this is the testes and epididymis are here. And after breaking the adhesion, I have just exposed the maximum part of the testes from left surface, the right surface, okay, it's a lateral surface, the medial surface, then the anterior border. Okay, so this is the medial surface, this is the lateral surface, this is the anterior border of the testis, and this is the epididymis. And I will show you the part of the epididymis also. This is that head of the epididymis here, then this is the body. And let me expose the tail of the epididymis also. I am trying to expose the tail part of the epididymis. Now, adhesions, okay, lot of adhesions which are making it difficult to remove because it is a closed serous sac, the visceral and parietal layer of the tunica vaginalis. They have also fused, like those, the facial layer were fused with each other. In a healthy testis, that should not be the case. Okay, there should be a clear cut, I mean to say, cavity between the visceral and the parietal layer of the tunica vaginalis. Okay, most of the part I have already cleared, right? So if you see this testis, okay, then you can see this testis is seen completely here. See this? This is the upper pole of the testis. This is the lower pole of the testis. This is the, I'm to say, lateral surface of the testis, and this is the medial surface of the testis. Thus, this is the anterior border of the testis, this border, anterior border, and here is the posterior border where the testis, I mean to say, giving attachment to the epididymis, okay? And now you can see a space here. This space is the sinus of the testis or sinus of the epididymis. Now, this is the head of the epididymis, the body, and here is the tail. From the tail, the vas deferens will start, and which will be the main constituent of the spermatic cord. I will show you the contents, okay? Let me reflect this thing, and then I will go to the contents of the spermatic cord. Now, this is the epididymis, and thus this testis is showing a sinus here onto the lateral surface. So this is the medial surface. So to which side this testis should belong, because it is the anterior border is here. So this is the right testis, okay? It is the right testis. You can hang the testis with the spermatic cord, okay? Spermatic cord like that. So this is the right testis is here. Now, once you have seen the testes, okay, this covering is because of the visceral layer of the tunica vaginalis, and this is going into the sinus as well as onto the epididymis, the covering, and this onto the testes, except that it's in posterior part, okay. The covering is not extending, and all the contents of the spermatic cord, they lie posteriorly, okay. That is artery, the veins, the nerves, pampiniform plexus, the nerves, and then the arteries, testicular artery and the artery of the vas deferens, they all lie here, okay, covered by 3 layers of the spermatic cord. And which were 3 layers? First was the external spermatic fascia, second was the internal spermatic, the cremasteric muscle and its fascia. You can see the cremasteric muscle and fascia here. See this? Just these are the muscle bands, okay, going. This is cremasteric muscle in its fascia, and they are all fused, so I cannot show you the all 3 fascia very clearly. Probably this is the internal spermatic fascia, which I have just exposed, which is intimately covering to the deeper structure. So this is that internal spermatic fascia, okay, in my finger is the internal, because it is not having the cremasteric muscle in between. So I will remove this 3 membrane, okay, and will show you the different contents of the spermatic cord. Let us see now the contents of the spermatic cord, which is in this testis is real difficult to show you because of lot of adhesions. One has to feel these contents, and if you can feel a rubbery tube, muscular tube, and this muscular tube is the vas deferens or the ductus deferens. I am trying to, with the help of the finger, feeling it and removing this ductus deferens, which carries the sperm right from tail of the epididymis. See this, I have just dissected out with the blunt dissection. This is that the ductus deferens, which is cut at the superficial inguinal ring in the operation of family planning. A surgeon isolates this ductus deferens, cut at 2 ends, and then tie it. Both the ends are tied. That is called as the vasectomy operation. There are other structure with this, okay, which cannot be seen. It must be associated with the artery of the ductus deferens, an artery. There should be an artery for the testis or the testicular artery. Let me dip into the water. Testicular artery. And all these structures, they are embedded within the pampiniform plexus of vein. So, I am trying to find the testicular artery and the pampiniform plexus. The rest of the other these constituents or the contents of the spermatic cord, they must be very fine. With the help of the hand lens only can be seen. Now this plexus, I have just exposed the plexus, which is a venous plexus called as the pampiniform plexus of vein. Here if you can see, these are the veins, okay. The pampiniform plexus of the vein is there, okay. May not be seen clearly here. You may not be able to see it, right. This is that tuft of the veins. That is the pampiniform plexus of vein. I am trying to find out the testicular artery if I can get it. Yes, it is here. I will just try to expose this testicular artery in its small part. So there is a artery here, yes, surrounded by the pampiniform plexus. I will just lift it with the help of forceps. That is having a thick wall. That's why I could find out. Okay, here. This is the testicular artery. Just a minute. This is the testicular artery, okay. This artery is the testicular artery, was surrounded by the tuft of the pampiniform plexus, okay. So this is a thicker structure, and then the nos cannot be shown, the sympathetic nos, because they run on the testicular artery forming a plexus, okay. And it is also difficult to find out the artery of the vas deferens. So many contents of the spermatic cord are here. So we have seen the pampiniform plexus of the vein, the vas deferens, the testicular artery, and the nos I cannot show you. I could not find the that is the artery of the vas deferens, which must be very thin and closely applied onto the vas deferens itself. I think this is no. I need a magnifying glass to see it. So these are the constituents of the vas deferens, spermatic cord, which are covered by the three membranes, that is the external spermatic fascia, cremastic muscle and its fascia, and then the internal spermatic fascia. You have seen the epididymis, head, body, and the tail is here. Now what I am going to do is that I will take a cross section of this testis to show you that mediastinum testis, okay, and how the seminiferous tubules are present in the lobules. So I have given a transverse cut, okay, the transverse cut into the testis, and on the posterior aspect or the posterior border of the testis here, you can see there is the presence of this condensed connective tissue that is called as the mediastinum testis, and this mediastinum testis sends many septa, and this septa will divide the testis into 200 to 300 lobules, and within the lobules there are presence of the seminiferous tubule. Each lobule can contain one or two or three seminiferous, which are fine coil tubules. Okay, I will try to lift this seminiferous tubule. These are the coil tube. These are all seminiferous tubule, if you can see it. These are the fine coil tubules of the This has to be a underwater dissection just to lift the some of the tubules. I will try to lift. Yes, I could see it. Okay, this is a seminiferous tubules, coiled seminiferous tubules. They are compactly packed here. Okay, and these are tubules are responsible for the production of the spermatozoa, sperms. I cannot show you the septa, they are fine structures, lobules, but the seminiferous tubules, if you will try to lift it with the tip of a pin, you can just lift some of the seminiferous tubules up, okay, some of the seminiferous tubules here. Okay, so these are the fine structured seminiferous tubules which are present. Now this seminiferous tubules then opens as a straight tubules in the into the mediastinal testes. Then there is a retracted testis, and then they just form the efferent ductules, which will form the head of the epididymis. Okay, and then in the tail and the body, there will be a single duct which will go out as a spermatic in the spermatic cord as the vas deferens. So this is the testes. Okay, this is the testis, dissection of the testes and the spermatic cord. Okay, spermatic cord. Now you, for the site determination, you hold the testis in such a way that its anterior border faces anteriorly. Okay, hang it with the spermatic cord, anterior border faces anteriorly, the medial surface should face towards the median plane, and lateral. How you will differentiate a lateral? The site on which the epididymis is present is the lateral surface. So sinus of the testis or the epididymis should be on the lateral side. So this way you hold it in anatomical position and then determine the side of the testes. Thank you very much for watching this video, okay, on the testes.